this computer. And I will just start by introducing myself. My name is Samantha Breslin. I am the Senior Program Coordinator at the City Health Dashboard. And I work pretty closely with users on, helping them identify where our data can be put to use and where gaps in workflow might exist and where data can kind of come and like improve capacity in local communities and more and more smaller communities. And I am joined by my colleague, Callie Pastor, who will start and kick things off for us. And Callie, feel free to take it away.
Hi, so good to meet you all, and welcome and glad you joined us. Seems like a lot of you guys are here for the right reasons, so happy you made it. So this is a virtual office hours. We do these once a month, and they're just meant to be small, like hands-on interactive webinars to give you a little taste for what the dashboard is, what we're trying to do, and then today we'll dive a bit deeper into the Put Us on the Map challenge, which I think you guys are a bit familiar with, and we'll give you all the details soon. So I'll start with a brief overview of what the dashboard is, and then Sammy will do a little highlight demoing some of our features, then we'll actually get to the gist of today's meeting. So our goal here at the dashboard is really to help cities like where you guys are use power of data to really improve health and the well-being of everyone in their community. So we were created back in 2018 with the ultimate purpose of really working with mayors and community leaders to improve health in their cities. So most data on health and its drivers previously was available at a lot of like county, state, national levels, but not so much at the city and neighborhood levels. So that's where we came in. And we have been changing that for now over 900 cities throughout the US. We started back in 2018 with 500, and now we've worked our way up to have every city in the US on the map that has more than 50,000 people. And we've been launching some initiatives recently, the past few years, to really get more and more cities on the map, especially those that are small to mid-sized that might not have as much access to this data. So we were developed by a team here at NYU School of Medicine in the Department of Population Health, and we work very closely with NYU's Wagner School, the National Resource Network, the National League of Cities, and ICMA. And so we all came together and worked very closely alongside city partners to decide how we select our measures of health, to work on website development, to make sure it's very user-centric, and to see how we'd implement this all into one spot so that we could be the one-stop resource for all of you guys for city data. And so we've really worked with a lot of different people and different organizations involved in this process. We ourselves are an academic institution, so we really wanted to make sure that our methods and everything were very rigorous and just as good as they could possibly be. And so we really got the real world city perspectives when designing this tool, and we hope that it can be very useful for you all. So we've designed the dashboard to be very flexible and be able to be used in a lot of different ways. Some of those ways we've listed here, so you can really compare health gaps across neighborhoods when you look at the maps. You can compare your cities to other cities in your region or other cities with similar properties as yours. And then this will hopefully help cities better set priorities and target resources. So the way we really decided to select the measures that we have on our dashboard, we looked at all sorts of national data sets. We used rigorous methods underlying original data collection, and we really want to make sure that all of our measures reflect public health priorities. On top of that, we wanted to make sure they're amenable to city level interventions, not too large, not too small, but really hitting that nice spot. And we make sure everything's updated regularly all the time. So make sure you subscribe to get those updates. And then we balance all of these measures across 5 different overarching domains. So to date, these are all the measures that we have on the dashboard website. The 5 domains are listed out here, being health outcomes, social and economic factors, health behaviors, clinical care, and then the physical environment. So these are kind of the big categories. Each one you can see on the bottom left. The ones that are blue are just city level data. The ones that are highlighted yellow, those are city and neighborhood level. So that's it for me. I'm going to pass it on over to Sammy now for the fun stuff, to do a little demo of our site so you can really get a feel for all the features that we have.
Thank you, Callie. Let me just share my screen. Is everyone able to see my screen? Great. So the City Health Dashboard is a free, accessible tool to anyone who wants to use it. All you have to do is come to cityhealthdashboard.com and you have access to all of the data and all of the features that we provide. Nothing that we do or that we provide is behind a paywall. And once cities, and this will go for the smaller cities that are applying for the challenge, once your city's data is on our tool and on our site, we will update it and it'll be provided for you for free forever. For as long as we are a website, you will have access to your data, our features, and all of the other, really powerful data that is on the site. And so we'll just do a quick demo showing you how to use the site. And again, this will be helpful for thinking through, how can this website and how can our features be, leveraged for you if you are selected, but to include in your Put Us on the Map applications. So you just type in your city in this search bar here. So I'm going to look at Morgantown, West Virginia, and you're taken to this select a metric field. And, sometimes we know what we want to dig into. All of these measures are the same measures that Callie listed previously on her slide. But so let's just say, you want to dig into poverty, you can click into children in poverty or broadband connection and get more information about those specific topics. But a lot of times we don't really know what we want to explore, and we want to see more of a high level overview how our city is doing and where potential opportunities or challenges may lie. So we can just click into the city overview page and for Morgantown, West Virginia. And Morgantown is a city that we added last year that is below 50,000. They actually were a 2022 Put Us on the Map city. So yeah, you can see they have a population of around 31,000. And then you can see all of the dashboards measures that we have available for Morgantown listed here. And you can kind of scroll and again, see that 360-degree view, or like a high level bird's eye view of what's happening on the ground in Morgantown. So we can click into any of these measures. They're all hot links. And when you click into them, you can get just some quick information about the metric, how we measure it, the source, the years of collection, as well as a thumbnail of the map. And you can click in and it'll take you to what we call the metric detail page. So I will just click here for annual unemployment for Morgantown. And what's great about the dashboard is that, once you kind of orient yourself to the symbols and the signs and, the visuals that we provide on our site, once you get a sense of how all of that works and what everything means for one metric in one city, how the sauce is made. All of our metric detail pages look the same. Obviously, the map changes depending on the metric in the city, but all of our signposts carry through across metrics and across cities. So it's really user friendly and really can meet people where they are across their data journey. So we want people who have absolutely no experience to find value, or no experience in data to find value on our site, but we also want the epidemiologist or the data analyst to find a lot of value on our site as well. And so here you can see the scale bar of the metric that we're looking at. So in this case, we're looking at unemployment, and there's a lot of information here, but this scale bar represents the range of values for a particular metric, where, you know, lighter colors indicate, and this happens across our metrics, lighter colors indicate better outcomes and darker colors indicate poorer outcomes. And this blue check mark tells you the direction of those better outcomes. So for a metric like unemployment, you want less of your residents experiencing unemployment. So those lighter colors and that blue check mark will be on this lower side of the scale. But for a measure like high school completion, for example, of course, you want more of your students, more of your adults having graduated high school or gotten, you know, a comparable degree. So the lighter colors would be on this side of the scale bar. And then this gold bar represents or tells us the city or the census tract value for that metric. So in Morgantown, 10.9% of the labor force was unemployed in 2020, and that's compared to 5.7%, which is the average for all of the dashboard cities. It's similar to a national average, or it's a proxy for a national average, but it's not quite a national average because it's only looking at the 900 plus cities that are on our site. But it's pretty close. So Morgantown's unemployment rate is, you know, about 5% higher than the average across all of our cities on the tool. And this green check mark, which we don't see in Morgantown, unfortunately, will be present when and if the city or the census tract value is better than the dashboard city average. And for about 90% of our measures, maybe even higher at this point, I should do the math again. We provide multi-year data with some metrics going back to like 2012 or 2013. And so if multi-year data is available, you'll be able to toggle across years here. And so then just looking at the map, so here is the map of unemployment across Morgantown's neighborhoods or census tracts. They're census tracts, which in many cases approximate neighborhoods. So we use those terms interchangeably. And so you're able to see very much at a glance that there are clearly neighborhoods that are struggling with unemployment, and clearly that there are neighborhoods that are doing much better. And so you can click into any of the census tracts or neighborhoods here to get more information about the zip code it's a part of, as well as the value for that census tract. And look, you have, you know, two neighborhoods right next door to each other, that have very different unemployment rates. So this neighborhood here has 25% unemployment rate, which is extremely high. And then the neighborhood right next door only has a 3% unemployment rate, which is quite low. And so the dashboard is really helpful for identifying those gaps and kind of launching off into conversations and to research and to study into figuring out, you know, what could be causing those gaps. Who is unemployment most impacting in those neighborhoods, and helping us just get a better sense of the challenges that our communities are facing. And again, you can see, you know, the wide range of colors, which tells us that, you know, different neighborhoods have very, very different outcomes across Morgantown. And moving along this navigation bar, as we call it, so for about 1/3 of our measures, so really any measure where we don't have neighborhood level unemployment is a little bit different, is special because we do have neighborhood level data. But for a lot of the measures where we don't have neighborhood level data, where we only have city level data, we try to compensate for that like geographic granularity by also providing demographic data. So you're able to see how potential issues might impact different racial ethnic groups, which just gives us not only that geographic look at a challenge or a topic area, but also allows us to look at these things from a racial equity lens, and to see how how the 5 major racial ethnic groups compare to each other across various domains. So you can see the unemployment for Asians is almost 0%, versus for Black residents the unemployment rate is 15.5%. And so the different racial ethnic groups have very different unemployment rates. And we also provide these data broken out by gender, or by sex, excuse me, for unemployment as well. So you can see males versus females and what is happening for those various groups. And so where that demographic data exists, we will always provide it for our metrics. But if it doesn't exist because the data source doesn't provide it or doesn't collect it, we will not provide that data for those metrics. The dashboard also allows users to compare their city, or whatever city they're working in, to other cities on the dashboard, because there's a lot that we can learn from other cities. When we're working with poverty or we're working with unemployment, there are already so many amazing programs and policies that are out there that other cities have put into place, and perhaps we want to learn from them. Perhaps we want to see what's worked in other places and figure out how can we make it work, or how can we implement something similar in our community. So we have the ability to do that in 2 different ways. So if I'm Morgantown, perhaps I want to compare myself to Charleston, which is the capital of West Virginia. I can just type in Charleston as I did, and then Charleston's scale bar with their unemployment rate, or whatever metric you're looking at, will be pulled down below Morgantown. And we can see Charleston's unemployment is much closer to that dashboard city average, and much lower than the unemployment rate in Morgantown. But let's say, I'm a city planner in Morgantown, and I know that we're always getting compared to Charleston, and that's not really a great comparison. Charleston's much bigger than us. They have totally different demographics than we do in Morgantown, and it's just not really a fair comparison. And so for those places, or those people, or those users, perhaps they want to find other cities that match whatever's happening in their city. So we have the City Finder, which allows the user to select the filtering criteria that makes most sense to them and their work, to identify potential peer cities. So, you can filter by population size, for example, maybe location. We have South Atlantic, and then perhaps we want to do look at cities that have a similar Black population. And so as you saw, the more filters I kind of put into the City Finder, the smaller the city list got of cities that match that criteria. So we can see Harrisonburg, Virginia, and Pinellas Park, Florida. And as I click into each of those cities, they too will be brought down underneath Charleston, and we can compare their performance to Morgantown. And again, just like Charleston, these 2 cities, which have very similar makeups, are in similar regions, similar population sizes to Morgantown. Their unemployment rates are much better than what's happening in Morgantown. So again, for that city planner, what is happening in Harrisonburg, Virginia? Did they implement a policy? Are they working on, novel programs that perhaps we can put into place, or at least are there connections that we can make with the local government in Harrisonburg that can help us just learn more about this issue? And so moving along, the dashboard also allows users to compare 2 metrics for a specific city. Issues like unemployment or poverty or education, these issues do not happen in a vacuum, or they do not exist in a vacuum. They're very interrelated to other things, and they're very, connected to other challenges, whether it's housing or air quality or whatever it is. These things don't happen in a silo, typically. So if I am looking at unemployment, perhaps I want to also know the uninsurance rate in neighborhoods in Morgantown. Obviously, you know, when folks are unemployed, their health insurance becomes more precarious in many cases. And so we want to see, you know, what potential relationships might exist or what patterns we can find in neighborhoods across our city. So right now we're taken to another map of Morgantown, where the blue polygons or the blue shapes that we had seen in our metric detail page represent our original metric, so unemployment. And the red dots or pink dots that you see on top of those neighborhoods or on top of that map tell us the uninsurance rate for those neighborhoods. And again, lighter colors indicate better outcomes, darker colors indicate poorer outcomes. And so we can see there's some pattern, but you can see, you know, in these two neighborhoods here that struggle with unemployment also have relatively high rates of uninsurance. So you can see those patterns, those geographic patterns, and you're able to better see how two measures may or may not move together across neighborhoods in a city. And we also have the ability to view those associations or those correlations through a scatter plot. Again, the correlation is not so tight here, or the association is not so tight, but each one of these dots represents a census tract. So you can click into those dots to see the different rates or estimates for the two measures kind of plotted or charted against each other. And just as a note, or a caution, when looking at both of these maps and charts, it's just important to remember that just because two measures are correlated, or just because two measures might be similar in a given neighborhood, does not mean that they cause one another. So it's always important to take that caution. Then take action. I think a lot of people will be interested in the take action part of the site. So when we launched, when we launched in 2018, we did not have this part of the website that built out. But after hearing from users being like, okay, great, you showed me how my city is doing. I know that, you know, our unemployment rate is pretty high, but like, now what? Like, what can I do with this information? I don't really know how to put it into practice in my city government, in my health department. And it's like, I just don't know what that next step is. So we created this Take Action Center, which has, I think at this point, like over 450 different resources spread out across these 5 different buckets that you can use to implement in your community. So we have find policies and programs. As the name implies, this has a whole bunch of, actually, I'm going to show you the Take Action Center from here. So you can find everything you need from this main menu. And so we have, you know, over 330 different policies and programs across all of our measures. And so you can filter for any measure that you are interested in, and then that list will be filtered for the various evidence-based programs or policies that are proven to move the needle on whatever metric that you're looking at. Everything on this site or on this part of the site is evidence-backed or a promising practice. And this was it was curated by us, but to highlight only tools and resources and strategies that were created by organizations that we trust and that are evidence-backed. So you can trust that everything here is pretty rigorously collected. We also have resources that help you find partners. So who can we bring into the room? Who can we add to the seats at our table that could help us perhaps outreach to hard to reach communities? Who can we bring that could increase or improve our capacity? So we have all of those here. We also have strategies that help us communicate about data. strategies that help us outreach to diverse communities, tools to help us talk about the social determinants of health. Not everyone kind of uses that terminology. And so when we're talking to people who are not necessarily in the health space or the public health space, how can we bring them into those conversations about looking at the drivers of health? Find funding. There's never enough funding to go around for the programs that we want to put into place or put into practice. So we have various, not only grants that exist, that are kind of for the taking, but we also provide tips and strategies to help users actually apply for certain funding. And then finally, we have tools to help you measure impact and make sure that the programs or the policies that you're implementing in your community and the outcomes that you're expecting to see are actually what's being lived and experienced by the residents that you're targeting or the communities that you're working with. And then finally, I do just want to draw your attention to our data access page. All of our data is totally free and accessible to download, either through CSV files, like in this bar or in this box here, or if you're a more experienced data user, we have an API where you can kind of call the API and get larger amounts of data or more specific calls or specific types of data. But all of this is totally free for users to access and kind of integrate into their own local data collection, create their own, graphics or data visualizations. We want users using our data and not just kind of coming to the site, but we want them to actually integrate it into their work. And so with that, I will move back to the slides. Sorry. Is everyone still able to see my screen? Can you see the PowerPoint? You can? Okay, great. Let me just make this bigger. Okay. So now why we're all here. The Put Us on the Map challenge. So as Callie mentioned earlier, we, since launching, bringing data to smaller and smaller communities has been a major priority for our team. And when, in the beginning, we were kind of, strapped by the data sources that we use, because a lot of data sources don't provide the data for places that are smaller than 50,000, or they do provide, or the data does exist, but it's not analyzed. And so it's been a main priority of ours to figure out how to bring that data, to smaller and smaller places. So that led us to launch the Put Us on the Map challenge yesterday, because again, we had just heard from so many different communities, whether it was at conferences or webinars, just like, why is my data not on here? Why is my city not included? Like, I live in a small place and like, we don't have the resources or the capacity to do any of this data collection or analysis. So we launched the Put Us on the Map challenge. And sorry, I lost my map. Never a dull moment on Zoom. Hold on. Okay. Sorry, guys. Hold on. I do not know why this is not working. Okay, let's try. Okay, I don't know. My mouse keeps disappearing. Oh, there it is. Okay. So what is the Put Us on the Map challenge? It's a free, like I said before, opportunity for residents, local governments, nonprofits, what have you, to apply from smaller places to get their city added to the dashboard. And we plan to announce those cities in the next, usually, I think last year we announced it in April. And so we plan to kind of follow that same cadence. So we'll announce the cities this spring to then be added to the dashboard in summer 2023. Last year, we originally launched and said, only 10 cities were going to be selected, but we got so many amazing applications that we ended up selecting 29 cities. And so just because we got such good feedback from cities last year about the challenge, we're not kind of creating a threshold of how many cities we will take for this year's challenge. So there's not as much like stringent rules about like we're not taking more than 10 or 12 cities. And so who can apply? So any city, town, borough, village, township, what have you, is able to apply for the challenge as long as their city falls between a 3,000 to 50,000 population. And when the cities that we took last year really kind of fell, quite nicely in that range. We had some communities that I think were 3,300 people, and we had, I think, one community that was like 47,000 people. So it really ran the gamut. And for us, like, it doesn't matter like if a city is on the smaller end of that scale, it doesn't matter if the city's on the larger end of that scale. We are just looking for, strong applications of how the data can be used locally. And then in terms of who can apply, like the actual people applying, it could be an individual from a health department or someone who works like on a cross-sectoral team that is, comprised of a local government, a nonprofit, a hospital center, whatever it is, as long as they're represented by the community, by, the government, by staff, by teachers, that is fine with us. We are not prescriptive on who can apply. And just to kind of bounce off that, the existence of partnerships or cross-sectoral collaborations of how different groups could use the data once it goes live is always a bonus, but is not required. And so what will the selected cities get? Like I said before, access to your city's data on the site and all of our features. So everything that I just showed you in that demo will be available for all of the cities that get selected for the challenge. And then I have a list here of all of the measures that we will have available for our smaller cities. So Callie mentioned that we have over 40 measures currently on the dashboard. And that is true. We do those 40 measures are available for the larger places. So any city that is above 50,000. For our smaller places, where we have that data available, we will provide that data to those cities. However, some of the data sources that we use currently do not provide data for smaller places. So we provide a lot of data from the National Vital Statistics System, which is like the natality and mortality data that we collect from the CDC. And we do not have that data for any place smaller than 66,000 at the moment. However, when that data does become available, when we're able to get that data, hopefully in the next year or so, we will add all of the smaller cities, their data on various mortality and natality to the dashboard. So while we only have 32 measures available for the smaller cities, which is, a big majority of the data that we do provide, we will, as data becomes available, we will update that data and provide those measures for the smaller cities. So just because you don't have a certain metric available to you now or available to you this summer does not mean that the data will never be available for you. And like I said, we'll have 32 different measures available for the cities that will be selected on the challenge, and you're still able to get a very comprehensive look at what community health looks like, or view of what community health looks like in your city. So yeah, I mean, measures from across the 5 domains will be available for you. And then the second thing the selected cities will get is just support from the dashboard team, support from people like Callie and me, Callie and I, and, whether it's having webinars with your staff, introducing them to the dashboard, walking them through your city's data, helping you guys figure out, how to integrate your data locally. Those are things that we are very well equipped to help to support you on. And so we want to support you in those endeavors. If you have questions about the data or how things are collected or how different measures or metrics are measured, use us. We want to be leveraged in that way. And we'll make ourselves available to all of the selected cities. And then finally, a featured blog or impact story on the site. We love hearing from users and figuring out, how is the data working for them? And we want to highlight those stories when we're able to and when we can. So if a blog or an impact story or whatever it is something that you would be interested in, we want to highlight the work that you guys are doing. And so how to apply? Hopefully you've already seen the application and know that it's a very easy, simple form. It really shouldn't take you, longer than 30 minutes. I would say 30 minutes max. Of course, some people spend more time than others, but we want it to be, non-exhaustive. We don't want it to be a time suck for our applicants. And Callie will put the application form link in the chat. And so on that application form, we want to know, why is data important to you? People in this call, Jessica and Megan, you kind of explained why local data was important to you. We want to see that in writing. We want to hear those stories. So, the things that you hope to accomplish with the data, are there projects that you want to put into place? Are there just learnings that you want to have about your city that the data could be used for? Tell us that. Really basically tell us what you both said word for word in the application. That's the kind of thing that we want to hear. And just how data will make a difference. And this is just a logistical thing. If you're not from a city government or you're not a representative of a city government, we do request a letter of support from a partner that you've worked with in city government. Just as part of the application, and we provide a template on the form. It's honestly, it's a very simple form. You don't have to change anything about the template, just kind of get someone to sign off. And that's all that's required for that. And then finally, applications close March 1st at 5 p.m. And then here's just a quick timeline of the project. Like I said, applications close at the end of them or at the beginning of next month. We'll select the city, or we'll announce the selected cities in April, with them officially getting launched sometime this summer, most likely July. And then we will host a webinar in August for all of the selected cities. And we'll do something kind of similar to what we did here, where we'll walk the winners through the website and explain how they can put the data into use in their city. And then, like I said, support is ongoing as long for, as little or as much support as you need. We want to help you provide, or we want to help and provide that. And that is ongoing. So feel free to reach out to us at any time. And then finally, I just wanted to spotlight a couple of last year's winners who have already started putting our data into action. And I think this is just, it's good to learn about. It's always good to hear use cases or case studies about how other people are using data to solve problems in other places. And so I thought it would be a good time to just kind of dive into a few of last year's winners and see, what are they up to now? So in Hillsborough, New Jersey, they were hoping just to better understand the impact of COVID on their residents and on their various community members. And so they really leaned on our COVID local risk index. They have a larger senior citizen population in the city. So they wanted to also explore preventative services, which is looking at seniors who are getting kind of preventative checkups regularly, as well as on insurance, to better understand, which populations, which communities they should be targeting for various COVID education programs, vaccine promos, rapid test distribution. And so they, kind of came to the site, saw where the need was, saw who was vulnerable, and then outreached accordingly in various apartment complexes in those specific neighborhoods for all of this COVID outreach or this COVID response. So that's one use case. The second is comes from Marietta, Ohio. Marietta is a smaller place, and they were their health department was hoping to become, or was applying, or in the process of applying, to become a nationally accredited health department. And to do that is a whole long process, multi-year process, really, that requires the cities or the locations that are applying to implement a community health assessment and a community health improvement plan. And the accreditation board wants to see that a city has a good grasp on data and what health looks like in their community, but in a data-based or data-driven way. So they are in the process right now of about to start their community health assessment. And so they plan to integrate our data on children in poverty, diabetes, hypertension, on insurance and lead risk, as well as looking at our racial ethnic data to improve their understanding of like what the community's challenges are and figure out and help them drive their implementation strategy for this assessment and health improvement plan. And then finally, deploying mobile farmers markets in Petersburg, Virginia. So this team from Petersburg, really, they had already been really focused on healthy food access and food insecurity in that town, but didn't really have data to ground the work that they were doing. And they were just kind of doing it based on anecdotes and their own kind of perceptions of what need looked like in the community, which is a lot of times very, very accurate, but it is also important to ground our perceptions or to ground our anecdotes with data, just to make sure that we actually are having the impact that we want to be having, and that we're actually providing support and resources towards communities that need it, and no one is getting left behind. So they accessed our healthy food access measure, obesity, diabetes, hypertension again, as well as poverty, to identify neighborhoods that were struggling to find healthy foods, or neighborhoods that were experiencing food deserts. And then they kind of deployed these mobile farmers markets in those neighborhoods. And they've also used the Compare Cities feature. So they were doing a research proposal about various community-led interventions, and they wanted to compare themselves to a neighboring community to kind of make the case for the programs and the research that they wanted to implement in Petersburg. And so that is the last of the use cases. But if anyone has questions about other communities that have used the data from last year, happy to answer any questions. And then just happy to answer questions about the demo, the website, the challenge. I saw that Callie was active in the chat. I'm just taking a look at the chat in case anything needed to be addressed. Callie, okay, nope, you answered that one. Our application is going to be so this is from Dina. Can I use the letter of support to have other town departments such as police and fire sign their support as well, or is that not needed? So if you are applying from a local health office, because that is like a city government department, you won't need a letter of support from either of those organizations. What we mean by this letter of support from a city government is like if you're a nonprofit who's applying, then we would want the letter of support. But because you work for a government agency, that's fine. You don't need to provide that letter. Any other questions?
I was hoping, so I do work for a local health department, but we find ourselves being kind of the resource for data for our community partners, which is great. And we want more of that in the future. So like in that sense, we have goals and a project, but like a lot of times these partners have different projects. So, and if anything, our big goal is to just empower them. And also like, if we have these basic metrics on the website, which we can refer them to, then, you know, future collaboration might be something deeper, or like, you know, using more of our data resources beyond that. So I guess when I was, you know, filling out the application, my colleague and I were just like thinking, okay, project, like we have like 6 different.
I think you just say what you just said to me here.
Okay.
Like, that you want to use this data to further your collaborations and to help kind of, you know, make those bridges across sectors or across organizations, and to improve the capacity to do the work. I think that's 100% the kind of things that we're looking for with that question. It's totally fine that you have multiple projects and you can provide like you could talk about those projects. You don't have to. Again, you don't have to go into crazy detail. You can kind of keep it high level. We just want to see that like that collaborations do exist and that the data can be used to advance those collaborations.
Great. Thank you.
Any other questions or comments?
I have a question. So one thing that we've been thinking about a lot is just like program evaluation. And I come from the tech side. And so one thing I always appreciate is like the ability to pivot and to approach quickly from learnings. So with regards to that, how often is data updated? I saw like you can go back and look at yearly information, but just considering the cadence of what does that look like?
It's a great question. So we update our data on the site as the data source gets updated. For roughly all of our measures, but not 100%, we update our data at once a year. So you're going to get another year of data for each metric at least once a year. Some measures, like a couple of measures, are not on that cadence. In terms of, again, cadence looking at like data lags, we have 2 measures that are more in real time than the other measures. So in public health, you know, data moves a bit slower than what we're used to and what you're probably used to coming from tech. So you're going to see, you know, data that is from 2020, which might not be recent for you. It's certainly, you know, 2020 was 3 years ago. It feels like a lifetime. But in the public health epidemiological, world, a 3-year data lag is like not bad and is quite normal and is like quite recent. And so a lot of our data will be from 2020, although we do have, like I said, 2 measures that are more recent. So our current unemployment metric shows us data, I think through November or October of 2022. So it's just a little bit lagged. And our air quality measure also has monthly, and for the monthly the current unemployment, you're seeing monthly data. So monthly data starting from like 2018 through end of 2022. And then we also have an air quality measure that looks at ozone, which is another monthly measure. So you're able to see, you know, how air quality fluctuates across times of year. But most of our measures do come, like the most recent of them is like 2020. That being said, we are in the process of trying to identify what data sources exist that have less of a lag than 3 years. Data sources that not only exist, but ones that we can trust and are rigorously collect data for, you know, over 900 places. It's hard to find that data, or it's hard to find those sources, but this is something that we're actively thinking about actively trying to, remedy for users who look at the site and see 2020 data and think, oh, that's not relevant to me now. And so, basically what I just said, and that our data is updated at least once a year.
No, that's really helpful. And yeah, anything that we can get
Yeah.
be fantastic for our community. Do you have any examples of cities that have used this type of data for evaluation and have changed their approach based off the data?
Actually, yes. I want to just throw into the chat. So we collect when we have, relationships with users, or we find, compelling use cases or case studies of how other cities have put the data into practice. We add those stories to this impact page on the site. And so looking at evaluation, so we have about 15 impact stories on that page that I just put into the chat. And so,
oh, I think I see the one Rhode Island.
Yeah, Rhode Island. Yeah. So before, sorry, I'm opening up the Rhode Island or the Providence use case as if you're looking at it, but like I'm not sharing my screen. But in Providence, they actually obesity and physical inactivity was a big issue. Physical inactivity was a large issue in Providence, and the health office there had thought the driver of the physical inactivity was actually obesity, but didn't really have the data to back that up. And so we're kind of making not guesses, they were educated claims. Obviously, they're a health office, but that perception wasn't really grounded 100% in data. And so they were an early partner of ours. They were part of our pilot program, actually, the Providence Health Communities Office. And so when they saw their data, they were really, kind of triggered by the lack of walkability in their city. They had a very low walkability score, meaning that, there's not a lot of amenities on city streets. Safety wasn't, there wasn't a lot of safety in terms of like street lights and stop signs on their streets. All of that goes into walkability. Sidewalks weren't kept up. And so that data or that new perspective kind of led them to kind of go out into the community, understand what kept people from being active within the Providence, the public spaces in Providence. And so they were able to identify that, people didn't feel safe in specific neighborhoods. And so our data, along with their own locally collected data through surveys, led them to create more bike lane, like official bike lanes, make more safe, improve safety and improve lighting on streets, and all of these things that then went into improving physical inactivity. Whereas before, their programs were mostly aimed at like healthy eating. When those programs didn't really resonate, it was actually safety that resonated more, and walkability that resonated more with residents. So that is one kind of example of what you're looking for. And you found that, so I don't need to put it in the chat, but for anyone else who's interested, I can just drop it here. So that's one. There's a lot here. I'm just. Sorry, I'm just reading the ones that we have. I also think this one about COVID response in Waco that I'll put in the chat might be useful. When the city was, this was kind of very early days COVID, they were like really surprised by the fact that a neighborhood, this is kind of related to evaluation and shifting priorities, but not totally, but they were really shocked that a neighborhood that was indicated as being high risk for COVID transmission and COVID severity had not a lot of case rates, or had not a lot of cases in that neighborhood. And so they kind of used this this information to communicate with their city leaders about, you know, maybe like we're not seeing case rates, but like, why is that happening? Are people able to access COVID resources or COVID tests? If they're not testing them, we don't know if there's higher COVID in those neighborhoods. Are there protective factors in those neighborhoods that could be keeping people from getting COVID? So what they learned after talking with residents is that early on in the pandemic, two very strong community leaders, one was a high school principal, and one I think was a clergyman, were diagnosed and passed away of COVID early on in the pandemic. And so those deaths kind of scared and rallied the community to really take COVID precautions seriously. And because of that, it kind of created this protective factor where they were, you know, really adhering to quarantine protocols, adhering to masking mandates and all of that stuff. So that's one kind of example that is a little bit aligned with what you said, though not as closely as like the Providence one. Any other questions?
No, thank you for that level of detail.
Okay, well, as we are at the end of the hour, or the top of the hour, the top of the 3 p.m. hour, I don't want to hold anyone for longer than is necessary. But all of this is to say, if you have any more questions about the challenge, about your application, I am here to help, as is Callie. I am just putting my email into the chat. Feel free to email me. I'm also putting our info email into the chat. This is not like an email that goes into the ether. It's not some like big customer service account. Me and Callie monitor that that email every day. So if you want to email that account, we will respond there. But I also put my email as well. Feel free to email me, ask any questions, happy to help. And so with that, I look forward to seeing all of your applications. I know that all three of you will have very strong applications and I can't wait to read them. And again, reach out if you have any questions. And we put on these monthly office hours every month. They're not obviously focused always on the Put Us on the Map challenge, but we're always kind of changing the focus area depending on, you know, our own priorities, what's happening out in the world. And we do these every month. So please come one, come all. But we look forward to reading your applications.
Oh,
Thank you so much.
Thanks.
Bye.